we'll be starting with the topic of contrast media that are used in radiology. So what are the types of contrast media? There are broadly 4 types of contrast media that we use. Number 1 is barium. Number 2 is iodinated contrast media, iodinated contrast. Number 4 is MRI based contrast, and number 3 and number 4 is ultrasound contrast agents used in ultrasounds. So starting off with the barium based contrast. So barium is used in barium studies mainly, which are used in upper GI and gastrointestinal involvement. So the first pointer in barium based contrast is, which is the compound that is used? It is barium sulfate. Barium sulfate is used, and the atomic number, this has been asked previously, is 56. So what are the properties of this barium sulfate? First, it is water insoluble. It is an insoluble contrast media. Hence, it cannot be used IV. It cannot be used as an IV contrast agent. It can only be used as an orally or a rectally administered contrast agent. So this is very important. Rest all the other contrast media can be used intravenously. That is, they can be used IV because they are water soluble. So the first pointer with regard to barium is that it is water insoluble. And so which are the studies which uses barium sulfate? All barium based studies like barium swallow, barium meal, barium follow through, barium meal follow through, barium enema, and any other special studies which uses barium? Yes, there is a study called defecography, in which is used for assessment of rectal prolapse. Okay, so what are the types of barium concentration which are used in each of these studies? So barium swallow or upper GI contrast study. So barium swallow typically uses a high concentration of barium. High density barium is used. High density. What is the concentration? Around 200% barium is used here. In barium meal, little less concentration is used, around 50%, 50 to 100%. BMFT uses a thin, low density barium concentration, around 20%, and so does barium enema as well. Now, there is another study which uses barium apart from defecography and the GI barium studies, that is distal lupogram. So what is distal lupogram? So this is in cases of perforation peritonitis, when an ileostomy or a double barrel ileostomy and a distal mucous fistula is made, so after the acute presentation has settled, the surgeons want to restore the bowel continuity, and for restoring the bowel continuity prior to the surgery, they order this distal lupogram, in which the distal loop of the bowel, that is the distal mucous fistula, is cannulated, and a barium study and the barium is injected to see if there are any leaks in the distal loop or any strictures in the distal loop prior to anastomosing it. So if there are any leaks, the surgeons would not anastomose because it will further worsen the condition. So distal lupogram is done in that scenario, and in that a thin barium solution is typically injected around 15%, 10 to 20%, but definitely less than 20% barium solution is injected in distal lupogram. All right. So any other important pointers which we have to learn about barium is that in which cases you cannot use barium. So when is barium contraindicated in GIT studies? What are the contraindications? So the number 1 is any suspected perforation, any suspected bowel perforation. Second is in cases of obstruction, you cannot use barium. And in cases of obstruction, let me make a point that no positive contrast is given. The only contrast that is there is the fluid in the dilated distended bowel loops. In a case of suspected obstruction, you do not use any oral contrast, be it iohexol, be it barium, be it urographene, be it gastrographene. You do not use any oral contrast because remember, in bowel obstruction, you want to keep the patient NPO and its decompression is done through an NG tube. Okay, so you do not want to give any oral contrast in those patients. The fluid in the bowel acts as a neutral contrast. The third contraindication in which barium is not used is suspected post-op leaks, post-operative leaks, suspected post-operative leaks, because in both perforation and post-op leaks, why is barium not used? Because barium causes irritation of the serosal cavities and can lead to either peritonitis or mediastinitis. Okay, so barium is not used in perforation or suspected bowel leaks. And also in barium swallow, if you are doing it in a suspected TEF case, here also, because of the risk of aspiration into the trachea and the lungs, barium is contraindicated. So in TEF cases also, barium is not used. Now the fifth pointer is, if there is an upper esophageal stricture or mass, there is higher risk of aspiration. So due to higher risk of aspiration, barium is not used. Why is aspiration barium is not used? Because barium can cause pulmonary edema because it is an irritant. Hence, barium is not used in leaks, perforation, any obstruction, TEF cases, or any upper esophageal stricture wherein risk of aspiration is more. Here, what do we use instead of barium? So, instead of barium, we use iodinated contrast media as oral contrast in all these cases, except obstruction, where we do not use any oral contrast whatsoever. Okay, so this was briefly about the barium. Now this is the barium bottle that is available in the market by the name of Microbar HD, and this has barium in its powder form. Okay, this has barium in its powder form. It is high density barium. It is a high density barium, and we use the powder form of barium in mostly barium swallows. Okay, in barium swallow and barium meal. In barium meal follow through, barium enema, distal lupogram, we usually use barium suspensions. They are more thinner. We use barium suspensions. And in defecography, which we read was for rectal prolapse, we use barium paste. Okay, we use barium paste. Okay, so remember this image of Microbar HD. This is barium sulfate.